Equine Virtual Client Evening. This is the 5th and final client evening in this series. We started these back in September. I hope you've enjoyed them as much as we have. Now as the days are lengthening, we hope your evenings will be filled with busier things than Zoom meetings as the spring and summer approach. Once again, we've had over 200 people register for this evening, so thank you all very much for getting involved. They've been hugely successful, these evenings, and it's been one positive this last year. For those of you who may not have heard of XLVets, it's a community of independent veterinary practices committed to working together, sharing knowledge and experience to deliver high standards of equine healthcare. So tonight's an example of how we practices from across the country, from Orkney down to Devon and Cornwall, can join together to provide something for you, our clients. I'd like to highlight the support we've had from some important suppliers to the XLVets equine practices, the companies which supply the medicines and equipment we use to treat your horses. So that's Boehringer Ingelheim, Bova, MSD and Norbrook. Their contributions to these client evenings mean we've been able to put them on free of charge, and we've also raised over £1,000 for Vets with Horsepower as a result of these client evenings. Again, Colm, I hope we'll be able to send around the link for donations. So these evenings are free, but charities have been hit so hard this last year. Please support them if you can. So the topic for tonight's meeting is head shaking, which I'm really looking forward to. It's fascinating. It's something which makes us vets in practice scratch our heads. We're really lucky to be joined by Veronica Roberts this evening. So Veronica is a senior lecturer in equine medicine at Bristol Vet School, and she's an authority on head shaking in horses. She graduated from Cambridge Vet School and followed that up with working as an equine intern at the Royal Vet College and a residency at Liverpool University. She's also worked in a number of referral and university hospitals across the UK and Europe. The European and Royal College of Veterinary Surgeons recognised specialist in equine internal medicine. And in 2020, she was awarded a fellowship at the Royal College for her contributions to clinical practice. That's a real honour to get that. So we're very, very fortunate to have Veronica joining us this evening. Before we get started, just a quick word on how we're going to run tonight. For those of you that have not joined us before, Veronica's going to talk for about 90 minutes. That's going to be broken down into two sections, one about diagnosis and another one about treatment. We'll collect questions through the chat function. If you can just type them into the chat box, we'll monitor those and then put the questions to Veronica at the end of the evening. We've got a lot of people on tonight. Please put your questions in, but I apologise in advance if we don't get through all of them. So without further ado, it's my pleasure to hand over to you, Veronica.
Lovely. Well, thank you very much for the kind introduction. I will now, you'll be quite relieved to hear, get rid of my video and I'll try and share my screen. And what I'd like you guys to do though, before you write too many questions in the chat, is in the chat, if you would just mind, just so I can look afterwards, no big rush. If write down in the chat if you either own or have owned a head shaker, because I would just find that interesting to know. Okay, so hopefully you can all see that okay.
Yes, that's coming through.
Perfect, that's what you want to hear, because otherwise we're in trouble. So a little bit of background here. So trigeminal mediated head shaking, what, why, who, and how to make a diagnosis. And then, as Jane said, I work for the university. Now, COVID has done a lot of bad things, and one of the things it did was close our equine hospital. So I am seeing cases at our next nearest equine hospital that has a CT scanner, which is very kindly B&W Equine Vets in Bredstone. But I do that still on behalf of the university. Just to remind everyone, again, if you didn't need reminding anymore, that this is to be in aid of Vets with Horsepower. And I think all your talks have been in aid of Vets with Horsepower, but in particular, the person who's responsible for my interest in head shaking is Professor Nottenbelt, because I did my residency with him at Liverpool. And my very first research project was actually on hearts. and it was rubbish, and I couldn't get it into any kind of publishable form. But you need to produce a research project too, in fact, in order to sit your specialist exam. So I had a little bit of a panic because I didn't have anything suitable, and so we pulled out some head shaking data, and I used that, and there we go. So that was the first of now many head shaking papers. So it's his fault, and this is his charity. So please raise some money for it. Anyway, this is what we were talking about, the advantages before you guys all joined of Zoom. And this has got to be the best one, hasn't it? So I got donuts, it's 160 of you. So I got donut for everyone, but it looks like I've got to have them. That might not be an advantage. Okay, so what are we going to cover? What's trigeminal mediated head shaking? As much as we know. Why do horses get it? We don't really know that. Who's affected? We know a bit about that. And how to make a diagnosis? We know some of that, but we're not that great at it yet. But that's what we're going to cover today. What, why, who, and how. So we're going to look at what we know, but more importantly, we're going to flag what we don't know, because that is a great unknown. We're going to look at the current best diagnostic protocol. We're going to consider the limitations of that, and we'll have a look at what might change in the future as well. So what is trigeminal mediated head shaking? Okay, it's perfectly normal for a horse to shake its head, and there's lots of reasons why a horse will shake its head. So when does a horse shaking its head become a problem? Well, we wanted to find out, because one of the things people asked was, how common is head shaking? And within that group, that head shaking group, some horses will have trigeminal mediated head shaking, others will head shake because they have a painful poll or a bad neck or something like that. So how often does a horse shaking its head become a problem was a research question that we needed to know, because everyone wants to know how common it is. And part of that, and it always comes down to money, doesn't it? But you're trying to get research funded. If you say to a charity, well, I want you to fund this research project, well, how big a problem is it? How many horses are we going to help out of the population if we sort, if we do fund this research? So you've got to find out how common it is, and we didn't know. So we did a research paper which we published in 2018. Some of you may have been involved in collecting data, but hopefully unknowingly. So we did a horse health survey. And the reason you can't ask people about head shaking, because then you bias it, you just get people who know about head shaking who answer it, so who are interested in head shaking. So we had to do a horse health survey, and we sent it around on social media and through Horse and Hound and all sorts of things, and there were lots of questions in there on sarcoids and laminitis and all sorts, and buried in there was a whole load of questions on head shaking. So we did some statistics that said we needed 1,000 owners, so that's what we got. So we put this survey out until we had just over 1,000 responses, and 4% of UK horse owners said that their horse had shaken its head more than was normal over the last year, and then 25% of those to a degree as to require veterinary attention. So 1% of the equine population, you're looking at somewhere between 10 and 20,000 horses each year in the UK, and that's actually quite a large number. So what are our clinical signs of trigeminal mediated head shaking? So as I've said, there's lots of reasons why you might shake your head, and potentially you're looking at 40 to 80,000 horses a year that shake their heads too much. 10 to 20,000 horses a year that shake their heads so much they need a vet. How many of those have trigeminal mediated head shaking? It's, by the time they get to a vet, it's probably about 90%. And one of the most important things that tells you is what they're doing. So trigeminal mediated head shake, as opposed to horses that shake their heads for other reasons, have very classic signs. Some of you will know these signs, unfortunately. Predominantly vertical head shaking, sharp vertical twitches and flicks, and accompanied by signs of nasal irritation, snorting, twitching the lips, rubbing the nose, striking at the nose, and it is both sides. No apparent physical stimulus, so people often say, oh, it looks like a bee flew up his nose, but a bee hasn't flown up the nose. They can be violent, and that can mean that they are unsafe to ride or handle. They're worse at exercise, crucially any exercise. So if your horse only head shakes under saddle, but not on the lunge, you are dealing with something else. They can't help it. Any exercise and they will head shake. Some of them will also be affected at rest, but they should be worse at exercise. Some horses are seasonally affected. Now, how much sort of proportion of that really varies on the study you're looking at, and probably on your criteria, because you can be seasonally affected in some studies and just be better in the winter, but still head shake, and others say you've got to be completely resolved in the winter to count as seasonal. So 25 to 64%. Some of them are only affected when exercised outdoors, not indoors, and some of you may have experienced that you can ride in an indoor arena, but you take the horse outside and they head shake, you bring them back in and they stop. And some of them are worse out hacking or near trees. So these are our classic signs, and unfortunately, looking, I had a very brief look at the chat just before I lost it to go onto the presentation, but then people are already writing up that they own a head shaker. So if you have a trigeminal mediated head shaker, you will recognize these signs. So snorting, sneezing, I put it on mute so you actually can't hear that, but hopefully you can see some shaking the head vertically, and they can't help it. And I've just put a few of these in just to sort of help show how classic they are. You know, horses very rarely read textbooks, but although the textbook on trigeminal mediated head shaking hasn't really been written yet, because we don't know enough to write one. I've written lots of chapters, but you definitely can't get a whole textbook out of this. We don't know enough yet. And they look the same. This is what they do. Out riding, we've got the same, very classic signs. And then this is really bad. When you can't even get relief in your own stable, you are doing this all the time and your life is miserable. So these guys are the really badly affected ones. So they're usually really classic, and think hard if they're not, and that's good. So whenever people contact me, and I get contacted several times a week, and the history is not classic, I get quite excited, because almost anything apart from trigeminal mediated head shaking is going to be better. And I get quite excited about it. So you want them to not be classic. You will get some that aren't 100% classic. So some that will only sort of head shake in the sunshine, so known as photic head shakers, but you've got to take out the other things that come with sunshine, because we know there's some kind of complex environmental condition, or environmental interaction. So if you have a true photic head shaker, they will stop head shaking if you cover their eyes, like this guy here. So this is a Grand Prix dressage horse, and he can compete in the UK with his eyes covered. He's allowed under BD rules. To go international, he has to wear tinted contact lenses, but he doesn't head shake if you do this. So he's a true photic head shaker, but they are few and far between. Some will only head shake in the rain. I don't know why, because it isn't an effect of the water. So you can trot them under sprinklers. I've done it. I got very wet. I have done it. And they don't head shake. There's something about what happens to the environment just before it rains, but some of them will only do it during the rain. And others just seem to have nasal irritation or nose dragging. Now, we're plumping them all in the same group as trigeminal mediated head shaking. That might not be correct. We just don't know enough about the condition. But most horses have read that textbook on classic clinical signs. This girl hasn't quite, has she? So she trots around, she's a nice horse, this, and she rubs her nose along the ground. And lots of horses, when you lunge them, stretch over their back, rub their nose on the ground, pick up a bit of dust, have a bit of a snort and sneeze, except this girl can't stop, she can't help it. She can't help it, and if you ride it, it's the same. So there is some sort of abnormal trigeminal something going on here, but she's not showing it in the same way as most classic head shakers. This horse, nice event to this one. Head shakes. Vertical. No snorting or sneezing though. And if you pop her on the lunge, no head shaking. And we repeated this quite a lot. We got her rider on and she rode, and then we got her rider off and she wasn't head shaking, and we got it back on and she was head shaking. So we were pretty sure she doesn't do it on the lunge, but she does it ridden. Now, she was nicely ridden, so that wasn't a rider problem, but she's actually ridden very well by a professional. And this was, although to me, and I'm a medic, so maybe I miss things, she looks sound to me, but she did actually have quite a painful sacroiliac joint, which I think only really becomes a problem when you start asking them to work. So that's her. So yes, head shaking, but not a trigeminal mediated head shaker. And there are your clues. She's not snorty sneezy, and she only does it ridden. What about this guy? Shake, shake, shake. Nasal irritation, so he's rubbing the nose. But if you look closely, he's, well, you don't have to look that closely. He's rubbed that left side of his face raw. I don't know if I'm screen sharing, if I can play that again. I'll have a go. Yeah, there we go. So you can just see he's rubbed that left side of his face raw. So it's only one side. We said the trigeminal mediated head shakers will rub both sides. So this guy, investigation with CT, you certainly could see nothing abnormal on a normal exam of this guy, but on CT and uroscopy, so looking in the mouth with a camera, he had a nasty tooth root abscess. Now a tooth root abscess normally just gives you tooth pain, but the nerve, the infraorbital branch of the trigeminal nerve runs just over the teeth, and it sits in a bony canal, but the infection had invaded the bone and irritated the nerve. So he's getting nerve pain, and that's what's making him rub and shake his head, but he's got a reason for that. He's not a trigeminal mediated head shaker. And this guy, again, a similar sort of story. So he does this when he's eating. He doesn't do this when he's being ridden. He's rubbing. He looks quite distressed. If he has got normal dental pain, they don't rub and shake. They just spit their food out in balls. But this guy, again, did have dental issues, but they were causing nerve pain because of erosion of that canal. So you may well be dealing with a horse with nerve pain, which you get with trigeminal mediated head shaking and with some other problems. But the guys that aren't trigeminal mediated head shakers can often have a physical cause for it that you can find and hopefully fix. So I have alluded to the fact that horses with trigeminal mediated head shaking seem to be suffering neuropathic pain. What is neuropathic pain? Well, I think we're on nearly 200 people in the audience now. With nearly 200 people here, some of you will have experienced neuropathic pain. And until a few years ago, I never had. But then, you know, you buy a young warm blood, don't you? And he's a bit of a moron. And he spooked at a bird, and I fell off and broke my leg. And my leg is still causing problems, but certainly for about 9 months, I had really, really severe neuropathic pain, and it was quite an eye-opener. What does neuropathic pain feel like? Burning pins and needles for me, predominantly. It felt like someone was setting fire to my leg. It's quite unpleasant. Electric shock-like pain that you'd be walking around hobbling around the supermarket on your crutches, and then you'd cry out in the aisle, which was embarrassing, but you couldn't help it. Really, really unpleasant. And over time for me that waned, and eventually it became, you know, someone just holding a match close to my leg effectively, and then just some pins and needles, and now it's all but gone. And I think that's where we are with horses with trigeminal mediated head shaking. The bad ones are having electric shock like pain, pins and needles, which makes them rub and snort and sneeze, shooting, stabbing pain. They can't help it but throw their heads up and down. Or you'll have the mild ones that maybe just twitch their noses a bit and do the odd tiny twitch, and it's no big deal for anyone. And they're probably right at the other spectrum, you know, the mild pins and needles and nothing too bad. So I'm sure these horses are on a spectrum of severity of pain, and you know that because they're on a spectrum of severity of clinical signs. So these horses seem to be suffering neuropathic pain of the face. Why are they suffering neuropathic pain of the face? So this picture it's a relatively unpleasant picture. The guy's under anaesthetic. He's not dead, I promise. These were studies that were done over in UC Davis, and I've been involved with some of those where, as over in California, we discovered that the infraorbital nerve was sensitized, so it fires at too low a threshold. What does that mean? Well, if you look at your hand right now, you've got loads of bacteria crawling all over your hand, which is grim, isn't it? And we can't feel it, thank goodness. But if you tap your hand, you can feel that. And that's because the sensory nerve to your hand has what's called a threshold point, which is the point at which it says this stimulus is worth me bothering the brain about. And so once the stimulus gets to a certain intensity, it sends, it fires an electrical current up the nerve to the brain to tell the brain about it. And that point is the threshold potential. So that's at the point at which the nerve bothers telling your brain. Now, horses with trigeminal mediated head shaking, their nerve is 10 times more sensitive than a normal horse. So the threshold point is 10 times lower, basically. And that means that your horse is massively sensitive, and it can't, you're developing pain because you're so sensitive to everything. And actually that kind of, and maybe we're jumping the gun a lot and making a lot of assumptions, but the worse at exercise, there's a lot more going on at exercise, isn't there? There's a lot more sensation coming onto your face at exercise than there is at rest. And if you imagine that's 10 times magnified, that may be why that happens. We're not 100% sure at all. So the technique for measuring that is somatosensory evoked potentials, but it does have to be done under general anaesthesia, which limits its use. The other thing I think we found was that both sides are affected, which fits with what we see, doesn't it? One thing that they did at Davis in California was take one horse who had seasonal trigeminal mediated head shaking, and he was tested in the winter. And his threshold for activation was normal. Now, he wasn't tested when he was affected, and that's what we need to know. We need to know if his threshold is low when he's head shaking and normal when he's not head shaking. We didn't find that out because these horses were donated for a research study, so the owners were going to have to put them to sleep because of their head shaking. So they said, well, you can do a general anaesthetic, do the test, and then you just overdose the general anaesthetic at the end so the horse doesn't suffer. So I totally understand why you didn't get the opportunity to test this horse again in the spring when he was head shaking, but it does leave us with some missing information. Now, finding out why the threshold potential gets low is the key, really, to finding out what's causing this. But we actually don't know what sets threshold potentials in normal people, never mind abnormal horses. So we are a way off there, but that's the missing key into knowing what's going on with these horses, because then we can target treatment. So why do horses get head shaking? I mean, we can pretty much summarize that with we don't know. And there's I've got lots of theories, and I've got lots of projects that I want to run and try and find out, but whether we'll ever find out or not, I don't know. There's very complex environmental interactions, but we certainly don't fully understand it at all. What do we know though? So the nerve functions abnormally, so it's too sensitive. But if you take the nerve and look at it under a microscope, and I was able to do this because I had 6 horses donated post-euthanasia because of head shaking for a study, and I'm very grateful to the owners there. We looked at these nerves under the microscope and they are completely normal. Now that's actually probably quite good. You normally get neuropathic pain because you've got nerve damage. That's how I got neuropathic pain for breaking my leg. But these nerves are completely normal if you look at them under a microscope. But there's a switch has been flicked somewhere. That means that they fire at too low a threshold. So we don't know what the switch is, and we don't know what's flicked it. But does that mean we can flick the switch back? Well, yeah, possibly. If we had a great big hole in the nerve, you can flick whatever switch you like, but we're no good at mending holes in nerves. So we're not, look at people with spinal cord injuries. We're no good at doing that. So if the nerve's structurally normal, that actually does give us some hope. And that does fit with the fact that some horses are seasonally affected. That fits with the fact that about 5% will go into spontaneous remission and get better all on their own. So the fact it's functional and not structural is actually a very, very positive thing. Unless actually you're the person doing the study, which sadly I was. And horse nerves are really long, really, really long. So we were going right from under the brain all the way down to nearly the end of the nose. That's really long, both sides. And we cut that nerve into microns. So I don't know how many sections we got per horse to look at under the microscope. And it was all normal. And it was honestly the most boring project you'll ever hope to do, but quite a useful outcome. else do we know about it in horses? So there are some clinical similarities to trigeminal neuralgia in people and to cluster headache in people, and potentially to migraine. There's no exact parallel condition, but this is one of the great things about working in university, is I'm working alongside 2 other research groups. So I don't know if you guys have heard of the Children of the 90s study. There's a big study that came out of Bristol following children born in 1990 up at St Michael's, and they followed them through their lives. And I've done lots of tests on them, and they are very good at looking at DNA and things like that. So they're helping me. And then there's a neuroscience research group as well that are helping me look at whether there's any parallels with things like migraine. So maybe we'll find some stuff out. I suspect we'll just still find no, but you still got to go looking. In people, you can experience neuropathic face pain secondary to herpes. But again, the group at Davis showed that that's not the cause in horses, even though horses do love to get a bit of herpes, and we thought we were onto something, we weren't. So who's affected? Worldwide, probably developed countries. I certainly am not aware of it in developing countries, even in their sort of developed horse populations, their competition horses. That is interesting. What I don't know if is it's real. Is it just an effect of the fact that a lot of working horses in developing countries are worked mostly in walk, and then maybe we wouldn't see it? I would think you couldn't ignore the bad ones, but I'm not aware of it, and I've certainly spoken to colleagues working in working horse populations, and they haven't seen it. I've had anecdotal reports in donkeys and zebra, but that's all. I haven't actually been able to go and examine these guys. And as I said before, somewhere between 1 and 4.6% of the UK equine population. It's acquired as a young adult, so you are not born a head shaker. You get it, and that in itself is a clue as to what's going on. When do you get it? Around 6, but a wide range. So it's reported from sort of a couple of years old, certainly into the teens, but there's a big peak at your kind of, peak of your, 6, 7, 8, 4, 5, the age that everyone wants to, you've got, it's most heartbreaking age, isn't it? They're at the top of their game, really exciting, full of potential, and then they start head shaking. So that's the age that seems to be affected, is the younger adult. There's more geldings than mares, 70 to 75%, but there's more geldings in a riding horse population than mares anyway, and actually it's about 70%. So I don't know if that's a real problem. Certainly neuropathic pain in people has a sex bias, but more often towards women. So other reasons, maybe the mares, there's more geldings than mares being ridden anyway. Maybe the mares more often go for breeding than come and see vets, because these numbers are from horses presented to vets. So I don't know if that's real, but it's more geldings than mares. Any breed for sure, and any use. So there's more general riding, but I think not compared to the normal population. And there may be fewer racehorses, but they're often younger. And I've politely put, they may have other factors limiting investigation. The less polite version is, I think, that possibly terminology in the racing world for head shaking is salami, unless you're very fast. So that might be a reason why we don't see so many racehorses. We certainly see ex-racehorses, but they are that bit older. One thing that people ask a lot is can I take a foal from a horse that suffers from head shaking? And there is certainly no evidence of direct heritability, but there isn't a study that's gone and looked at that specifically, or I'm sure it would have turned up that information. So I don't think that is a problem. And certainly if I had a horse that suffered head shaking and was not affected at rest, I would be quite happy taking a foal from them. You always take a risk, don't you, with a horse, but I don't think it's a bigger risk than any other risk you take with a horse. But there is something that means one horse becomes a head shaker when another one doesn't. There does seem to be a complex interaction with the environment, but it's more, you can't just blame the environment, because Freddie will start head shaking, but Eddie doesn't, and they've lived the same lives all the way through. So that does suggest you should chase down sort of DNA, RNA things, but and that's what I'd like to do. But whether I'll actually find an answer or not, I don't know. But it's a very interesting area. Why do you become a head shaker? So moving on to diagnosis, and some of you, if you're owning head shakers, will have been down this route. Diagnosis isn't hugely satisfactory because it's a diagnosis of exclusion. So we don't have a test for trigeminal mediated head shaking. And that does mean we're likely to overdiagnose. So a study that was done at Bristol actually in 1987 said that 98% of cases presented to a hospital for head shaking investigation were diagnosed trigeminal mediated. It was called idiopathic head shaking at the time. But what I did was I should do this properly really, but I did an unpublished hand tally. So I'm not very good at statistics. I just sat down with a bit of paper. And we get about 90% of horses that come into the hospital that see me that get diagnosed trigeminal mediated head shaking. But that's not going to be 90% of horses that head shake that get this diagnosis, because those horses will have been looked at by their owner. He will always try, sensible stuff, changing the tack, whatever, having a look at it, getting someone else's opinion. They'll get their vet. Their vet will have a look at it, and it's only if their vet goes, well, I think they are trigeminal mediated, they speak to me. I have a look at videos before the horse comes in, and at that stage quite often I can say, oh, I think it's this, try that, and then they never see me. So that 90% is actually horses that have been looked at by an owner who's thought, yeah, I think that's what it is. Looked at by their own vet who's gone, yeah, I think that's what it is. Looked at by me before they come and see me and gone, yeah, I think that's what it is. And then they come in and we run diagnostics, including things like CT. And at that point, I find 10% with something else. So I think we are actually not looking at a world where 90% of horses that head shake are trigeminal mediated. It's 90% that come to a hospital referral population, having already been through a few sensible channels. So I think we're ruling out more than we were in 1987. But I still think we're probably overdiagnosing some because we don't have a specific test. We do have much better diagnostics now with CT, and I'm certainly not the only person. Hanover have recently reported a similar number of horses that they find on their diagnostics to have something else. So I think that's about right for us at the moment, but we're still overdiagnosing a little bit. Can we make it better? Well, potentially we could, as part of the tests, run those somatosensory evoked potentials. So is your nerve sensitized as well? There's other reasons for sensitizing a nerve, so it wouldn't be the only test. You still have to do all the other things. The reason I don't do it is because you have to do it under general anesthesia. And I just worry about running a test that's still not much known about it, that might not change how we manage a case with all the risks of anesthesia involved. But I think watch this space there, because if we find it starts to change how we treat horses, I think we will start to do it. So not sure about that yet. That might change. So one question that I get quite a lot is it worth trying to make a diagnosis? I.e., if you think your horse is a trigeminal mediated head shaker, are you better to spend your money on treatment than on diagnostics to tell you what you know already? But I think almost any diagnosis is better. So take the 10% chance. This is a hospital population, the 10%, so there's going to be far more in general practice. So certainly see your own vet. There's a massive increase in awareness of the condition amongst owners, which can lead to an owner-led overdiagnosis, which is great as long as it's followed up with a vet visit. It's such a different world. The first research paper that I wrote on head shaking, I can't remember what year that was in. I dread to think it wasn't that long ago, really. Things have moved quite quickly. Probably I think it was about 2008, 2007, 2008. And at that point, we were still dealing with insurance companies that didn't pay for head shaking because it was a behaviour. It was the last diagnosis that an owner chose, effectively. You know, that there were lots of other things, and that was always the kind of last resort. And now it's changed, it's on its head, and actually people are very aware of it. But it does mean that quite often we can find something else, which is a good thing. So it is worth making a diagnosis. This little guy can tell you a little bit about that. So this was Bernie. He was a lovely chap. I think he still is a lovely chap, cheeky though. 8-year-old New Forest gelding, and he was used for long hacks in the New Forest, and the owner had owned him for 4 years. So a long history of owning him, and I think he'd been owned by the trainer before that, and they still stabled him there. So he had a recent history of episodes of violent vertical head shaking. He did them when out hacking and not in the arena, but he did do it when he was out on ride and lead. So it isn't a rider thing. He didn't need a rider. No nasal irritation there, and he always did it on the turn for home. It didn't matter where you did that turn for home, he always did it on the turn for home. So he's not totally classic there, is he? But certainly is vertically head shaking. So we didn't find anything that would cause head shaking, and he was a cheeky monkey, and we said, well, I don't think he's classic. Let's just make sure there's no musculoskeletal pain. So we did a bute trial, and we said, look, I don't think he's got neuropathic pain. I don't think he's got musculoskeletal pain. He's probably just being a monkey. So they were very, very good. And as soon as he started doing it, they just put him into a shoulder in, and he just stopped. So it was really worth doing that because they love this guy. And the worst, no one wanted to tell him off effectively if he was in pain. So it was part of making sure he wasn't. And he certainly didn't have a very classic presentation for a naughty monkey horse either. Apart from that, once you met him, you were like, you are a cheeky little thing, aren't you? So he's okay now, and he's lovely. So how do we make this diagnosis? So history and observation is the most important thing, I think. And as I put, think very hard if they're not classic. And for the poor clients who come to see me with a head shaker, we'll spend a lot of time looking at videos, talking about the horse and watching the horse. And I think you get so much information from that. So this is, just to remind you how they look. And the classic ones look like this. Not always quite as pretty though. Isn't that a pretty colour? So we'll find out, is your horse the right sort of age? They can certainly start in their teens, but as soon as you phone me up and say, well, my horse is 24 and he's just started head shaking, he doesn't have trigeminal mediated head shaking, he's got something else. When does shaking occur? So someone I spoke to a couple of weeks ago, their horse head shakes in the stable, doesn't head shake out riding, isn't going to be trigeminal mediated. I hope we should find something else. Vertical head shaking. So if they're shaking side to side, they've got something else. Now they don't always, haven't always tried bute, but if they have, that rules out musculoskeletal pain. So if your horse responds to bute and head shakes less on bute, it's got musculoskeletal pain, not neuropathic pain, because neuropathic pain does not respond to normal painkillers. What about steroids? Allergies respond to steroids. We know there's an environmental interaction, but it doesn't appear to be allergy. But if your horse stops head shaking on steroids, which are the best allergy medicine in horses, much better than antihistamines, they have a different sort of bias to their immune response to people. So allergies, they work much better with steroids in horses. So if they've had a course of steroids, either by powder or through an inhaler or a nebulizer at home, and they are better, then we need to go chasing allergies. What about a nose net? And I'll talk about nose nets a bit later, but if you are better with a nose net, you probably are a trigeminal mediated head shaker. But if you're not better with a nose net, you can still be a trigeminal mediated head shaker. But all of this is important information. I then have a go at grading them, and I made up this grading system, and that means that I'm very open to criticism on it. But we need an objective measure. We need to know how bad the horse is head shaking, partly for insurance. So as I've put there for beaver guidelines, and I hope that none of you have come across them, but I'm sure you will have done, if you need to put in a mortality claim for your horse for life insurance for him, then usually they're only covered under beaver guidelines, and those are largely that the horse is suffering uncontrollably and needs immediate euthanasia, and that would count horses who are head shaking at rest. If your horse only head shakes during ridden exercise or sort of forced exercise, if you like, then they could be retired, and therefore they don't come under beaver guidelines, and people aren't eligible for life insurance under their insurance policies. So establishing whether or not your horse is a 3 out of 3, which is head shaking even at rest, is important. And otherwise it's very difficult to judge a condition that varies day on day, but I tried to go sort of 1 out of 3 is they head shake a little bit, but it's not so much as to interfere with ridden exercise, and then 2 out of 3 is it does, the horse is impossible or dangerous to ride. But even there it varies a lot, because a 1 out of 3 horse might be fine to do leisure riding with the odd twitch and nose snort, and you know the horse has probably got some mild pins and needles, isn't suffering, and it's not affecting the horse's performance. But if you're a top dressage horse, you can't do that. So you then are a 2 out of 3 as a dressage horse, aren't you? Which is, so it's not a perfect grading system, but it is it's the best I can do. So what about finding out whether or not the horse is shaking due to face pain? In people, you just ask you, does your face hurt? In horses, it's much harder, but you're all familiar, aren't you, with lameness? Well, again, I'd like it if you weren't, but I'm sure you're all familiar with lameness investigations, where you put, you want to find out why the horse is lame on that leg and where it's lame. So you start off putting local anaesthetic at different points on the leg. And at the point that you numb the right nerve, they stop being lame, and then you investigate that area. So we can put local anaesthetic around the horse's face and try and prove that they are head shaking because their face hurts. But it is not a hugely straightforward procedure. There is a straightforward procedure where you put the local anaesthetic down towards the nose, and it's relatively easy to do, but it's not very useful. So the nerve block that I do is further back, and you put the needle in just behind the eye. But it's certainly not ideal, and I don't do it in a lot of cases. Why? Because if you get a positive result, so you put the local anaesthetic around the nerve and your horse stops head shaking for, you know, the period of time that the local anaesthetic works for, that confirms face pain. But it doesn't show why you've got face pain. So it's still not a test for trigeminal mediated head shaking. It's a test for face pain. You've still got to go and find out they haven't got, I know, a bad tooth or anything. But a negative result doesn't rule it out. So if you put the anaesthetic there and they continue to head shake, you can't say, oh, it's not his head. Now, why not? Because we're not terribly good at doing it. So again, I did another study where we did these nerve blocks on cadaver heads that again had been donated for research, and we did CT scans on them once we put the needles in, and realized that if you're experienced at doing it, you're in the right place about 80% of the time, and if you're inexperienced, you're down in the 20%. So it's not a very easy test to do, and I was the experienced person in this study, but my 80% does not translate to 80% in the live horse. Because, you know, my cadavers were terribly well behaved. You know, nobody moved. They all stayed there nice and still at a beautiful height. I could rest my elbow, line myself up, take lots of time. Now, if I try putting this needle into a, you know, 17-hand horse, only very lightly sedated, and is rather taller than me, I am definitely not getting 80% in the right place. So it's not a terribly good test. I then did some more work on it that said, you know, that where you're confident in your diagnosis of trigeminal mediated head shaking, response to a nerve block doesn't predict treatment outcome. So as long as you're sure you've got the right diagnosis from all your other tests, then actually maybe you don't need to do a nerve block. It doesn't necessarily add to what you're doing. But when do I do it? So you've got to be head shaking consistently. So if you're very variable, you don't know when you put the local anaesthetic in, if you stopped head shaking after that, because you tend to stop every now and again and start again later, or because you've really done some work. They've got to be quite bad. I think it's hard to see a difference otherwise. They've got to be affected at exercise. I find it very hard to judge if they're just affected in the stable. They're so distracted by so many things, eating and looking at horses walking past on the yard. So I think trying to reproduce the same conditions before and after you've put the local anaesthetic in is useful. You're not sure. So the last horse I did this test on was quite lame on a front leg, and there were lots of reasons as to why we weren't chasing the front leg lameness, and part of that is because do you, if your horse has trigeminal mediated head shaking as well. But it was the horse head shaking because her leg hurt. Well, she could have been. So actually we used the local anaesthetic on her face to see if that stopped her head shaking, and it did. And she was obviously just as lame on her front leg. So we then knew where we were diagnosis wise. We definitely had face pain in her. She wasn't head shaking because of her leg. You're aware of the limitations, so everyone knows that if you get a positive, it tells you information. If you get a negative, it gets you nowhere. And you're aware of the risks, and there are a few risks of doing it, some of which can be quite significant and need to be discussed before you do them. So this is me doing this as a 10 centimetre needle, and we pop it in behind the eye. Now there is a local anaesthetic in this guy's skin, so he's not feeling it particularly. He's just got an eye on me because he thinks I'm up to no good. So you pop the needle in there. Oh, it's a long one, and then you put in your local anaesthetic. And most of them don't mind it too much, actually. They don't know how long that needle is. But, you know, no one likes to do it for fun, right? But this is where it's useful. So this guy, oh, look, he's a classic head shaker. That's him before his nerve block. And then about 40 minutes after his nerve block, here he is. And he's stopped head shaking. So we know for sure that he isn't, you know, he head shakes because his face hurts. Why did we do it in him? Actually, in him, that was to help his owner. She was relatively young, on a big yard. Everyone had an opinion. She spent a lot of money on new saddles and things like that weren't causing it. So she could have this video on her phone when people came up with their ideas that just made her stressed. So there are, you know, and she could say, look, no, he head shakes because his face hurts. You know, I'm getting it looked at. Leave me alone. So there are places for doing it, but I don't do it routinely on every case, which I used to. I used to do that, but I think as we learn, we change what we do, and as we find out more about the test. So what do we do then? You do further diagnostics. So you either prove you've got face pain or you suspect it. You then try and find out if there's any gross pathology, which could be a cause for facial pain. And if you find any abnormalities, you might need to treat them and see if head shakings resolves. And if not, you get a diagnosis of trigeminal mediated head shaking. So what are our further diagnostics? So clinical exam, I think it's important to spend a long time just looking at the horse. And sometimes those findings lead to further tests. If I find they've got a very stiff neck or something like that, we might go and do some neck x-rays. But your clinical exam, don't forget that. Upper respiratory tract and guttural pouch endoscopy, so having a look up the nose and in the guttural pouches with the camera, examining the eyes. An oral exam using a camera as well, which just takes it that step up from looking at it with a mirror. A CT scan of the head, and I think these are really important, and we can most of the time do those standing. We're taking some blood, we're taking urine. At the moment, I don't know how useful they are because we don't know very much, but if we don't take them, we won't find out more. So there are things that suggest that information might be useful, but in the meantime, we just need to look for any obvious abnormalities in there. And if we don't find obvious abnormalities, then we will have a look when we've got more numbers and compare them to a normal healthy horse population and see if we can find a problem. But every now and again, we do find something abnormal there. So worth doing that. So here's ophthalmologists examining eyes for me and dental people examining teeth. So I do tend to try and franchise out the more specialist bits within my specialty. I am not the person to check your horse's teeth with a camera, but I know some people who are. And there's us doing a CT scan. I don't know if any of you have seen this be done, but it's pretty awesome, really. So there's Lucy looking through the donut, and this is all human equipment. So there's your donut. She's leaning on the human table. On this side, we've got this little platform that you load the horse into, and they don't mind it. It's quite like going on a trailer. Load the horse into, sedated for sure. We've got an IV line in there so we can sedate repeatedly without having to stab and look for a vein. You don't want to be trying to find a vein if the horse gets a bit panicky. You want to be able to sedate them quickly. So stood on there, bandages just in case anyone takes a sideways step. We've got their little blinkers on so they don't see anything freaky. And then we tape their ears to their heads because the donut's just not quite big enough, and you don't want their ears touching the donut halfway through the scan because that's the point that they go, oh, what's going on? So you load them up onto the little platform, rest their heads on the person table, get them all rigged up with their ears taped down and what have you, give them some more sedation. We take lots of time. We take about an hour to do a CT scan, lots of time, give them time. The little platform then lifts up a couple of centimetres off the ground on air. And then you pull the platform in through the donut, and then everyone stands back and the machine starts to spin, and then the platform reverses through the donut, takes the horse's head with it, and gets you the most amazing images. And you can see so much. And horses don't mind it very much, but I think part of that is giving them time to get used to that. But if you try and do anything in a hurry, it could go wrong. So just take some time. So that's just get a little bit closer there. So where is it useful? So for horses like this. So Dublin, not their real name, presented with a gradual onset of head shaking at 14. So a little bit old, not impossible, but a little bit old. Vertical head shaking, no nasal irritation. It started about 20 minutes into exercise. It was ridden, the owners didn't lunge, so they didn't know. We watched the videos. Lunged her in the hospital, which didn't head shake, and I was like, well, she could be trigeminal mediated, but no nasal irritation and gradual onset. So quite commonly for trigeminal mediated head shaking, it starts bang suddenly one day. Not always, but that again, from that reading the textbook thing, that's where we are. 14 is a bit old, but not impossible. And maybe she was better on bute, but they weren't really that sure. So it could have still been trigeminal mediated, but might not have been. But when I was going through this with the owners, they said, well, you know, we did get her in Ireland 4 years ago and she was passported as a 10-year-old, but only 2 weeks prior to purchase. So they already had her suspicions that she might be a bit older than the packet had said. We looked at her mouth and we thought, well, she's probably 18 plus or 20. And then we did a CT, and this is a CT section of her head. So right at the top is her going through her nose, and then you come down and there's a top teeth and there's a tongue and then her bottom teeth in her jaw. So it's just a slice taken through. And if you look at that scan, she's got very little what's called reserve crown. So those teeth are nearly all the way out. She's nearly going to lose those. There's not that much spare tooth in there. If you look at the same image on a young horse, you'll have teeth go up about 2/3 higher than that, if not more. So she should certainly have had at least another half as much tooth again for her age. So very little reserve crown. So she shouldn't really be 14. She was probably about 20, which makes her very unlikely to be a trigeminal mediated head shaker. And what we did find was marked what's called temporal-hyoid osteoarthropathy. So we put the little arrows there, but part of what's called her hyoid apparatus in the back of her head, that's a little bit of her brain in the middle there. They do have one, it's just tiny. She had marked arthritis, and obviously it's difficult without showing you a normal perhaps to appreciate that, but very exciting levels of arthritis in that area. So we said, well, there was an operation you can do, but, you know, given her age and the fact she might have responded to bute, we said, well, look, there's no, you know, take her home, try her on bute, and if it doesn't work, come back and we can look at operating. But she's actually done really, really well just with having a sort of steady level of painkiller in her bloodstream. So that is her doing fine now. So in summary, how do you diagnose trigeminal mediated head shaking? Positive response to the nerve block, no pathology, or a negative response to the nerve block, or you don't do it, or you can't do it. But absence of pathology and a high index of suspicion, you know, from talking to the owner and looking at the horse in the videos. And maybe in the future, we'll be doing somatosensory evoked potentials as well. You should have a high index of suspicion from history and clinical signs. They tend to have read the textbook. It is worth a thorough investigation, and any diagnosis of exclusion has got limitations. So that should bring us to the end of that one. I am going to stop screen sharing and then load up my next presentation.
Thanks, Veronica, that's fascinating.
And is that all right for me to just carry on? Or
oh, please, yeah, and we'll go through the questions at the end, if that's okay.
Not. Well, I suppose it's a nice thing about webinars is if people need another glass of wine, you can just go and get one. You don't have to wait.
Veronica, not you, Veronica, you've got to stay here.
Well, and not till the end anyway. Okay. Okay, that should be coming through to you now as well.
It is.
Excellent, good answer. Right, so this is the probably the more interesting bit, really, which is how do you fix them? But it's harder, and part of the reason it's harder is because we're not very good at knowing why they get it. Again, just to remind you who to contribute to, what are we going to cover? So why might we be able to treat it? Why is it hard to treat? I'm not going to spend too long doing anatomy and function with you, don't worry, but a little bit because it's relevant. Challenges to objective assessment of response to treatment, published treatment options, those that might work and those that don't, and a little look into the future. So why might we be able to treat it? And this is a bit of a rehash of what we've done. So we think they're functional, not structural. 5% of them will get better on their own. A whole bunch of them will get better in the winter. And we do know that the nerve is sensitized. So that's what we know. And although we don't know why it's sensitized or how, that's kind of what we need to fix, isn't it? So, and we should be able to fix it because it seems to be able to fix itself in some cases. So that's why we might be able to treat it. Lots of papers backing that up there. Why is it hard to treat? So neuropathic pain is rubbish. And again, as I said, I'm sure some of you have experienced it. And there was nothing anyone could do for my neuropathic pain, for my fracture. And you try drugs that just make you feel like a zombie, but you still hurt. But they do work for some people. But we know so little in people, never mind horses. So the best treatment for neuropathic pain in people is cognitive behavioural therapy. So teaching you to cope better with your pain, which is very disappointing and probably harder if you're a horse. We have a very incomplete understanding, that's polite, isn't it? We know nothing about trigeminal nerve sensitization other than it happens. And we don't really know how it makes trigeminal mediated head shaking either. My little theory, which may not be supported by other people, I don't know, is maybe there's lots of causes. They look the same. So you end up with a sensitized trigeminal nerve and a head shaker, but different horses may be caused by different things. And that means, in the same way that you're all lame on your left foot, if you're a horse with a bad carpus or a bad suspensory, you still look lame on your left foot. So maybe that's what we've got with head shakers, and that's going to make it even harder if that's the case. There's our nerve, so I'll just put that in very briefly, but that's the yellow one is the one we're looking at, and it comes out from under the brain, and then it goes through the skull, and it goes through a tunnel in the skull, and then it comes out at the nose. So that's the one we're really looking at. That's the largest sensory cranial nerve, and it gives you sensation mostly to the nose and the teeth, and that's the signs that we're seeing in these horses, isn't it? Snorting and sneezing, and you're moving the nose predominantly, and that's what this young lady here is showing us. So nasal irritation. So clinical signs of trigeminal mediated head shaking are mainly localized to the muzzle or nose area, which is innervated by this maxillary nerve. Any proven treatment for head shaking seems to work by reducing sensory input from the nerve. And that was even before we knew about sensitization. We haven't known about sensitization very long at all. What are the other challenges to developing treatment? I've already said to you that I do this grading system and it's very imperfect. We need an objective measure of head shaking in order to be able to validate treatments. And you all know, if you've had one, that some days they're better and some days they're worse. And if they happen to have a better day after you've started a new treatment, you think, well, no, I think this might be the treatment. This is okay. But actually it may not be. It may just be that natural variation. So we need someone other than you to be able to judge the effect. And we know from these two studies that there's about a 30% placebo effect, that you think your horse is doing better when they're not. And that's really important, because when people think, oh, I think this worked for my horse, and then they write it on a forum or on a bit of social media, and someone else reads it and they go, well, I'll try that. And all the time people are trying treatments that don't work, but maybe they do. Oh, I'm not sure. I'll try it for another week. their horse is in pain all the time. So actually we can make a big difference to animal welfare if we can get an objective measure, which isn't a person, to say, you know, is your horse better or not? And that's something that I'm trying to develop at the moment. You know, I class success in my studies as return to work at the previous level or above, but I think that's still not great, and that's where I want my objective measure. But I think just be wary of what you read on the internet. So remember the differences between an owner diagnosis and a vet diagnosis. And I think my horse is better before, rather than actually my horse is better because he, you know, 2-star evented last year and he's doing that again this year. So just be very careful what you read before you waste too much time and too much money on something that someone said worked for their horse. So I'm going to look at some treatments, and we'll look at published treatments. So we'll look at those that don't work. We'll look at those that can work. There is no cure. I'm not going to go into the minefield of unpublished treatments. There's everything out there, and there's lots of reasons why they're not published. But I think it just becomes too much. I don't mind talking about it in questions if we've got time, but we will stick to what has got some scientific basis that we know of. Most of the time, I do every now and again just go off piste a bit. So treatments with no proven efficacy. So we love a feed supplement as horse owners. Just like to point out, my leg fracture happened with my horse on a calmer. Hey ho. He could still spook at the bird. Double-blinded placebo-controlled trial. So as owners, you had a placebo, so supplement 1, or you had supplement 2, which was the real supplement, or whichever way around, I can't remember. And you had to get videos of your horse before starting the trial, during supplement 1, wash out in between where you had nothing, during supplement 2, and afterwards. And as the owner, you said, oh, I think he's better on supplement 1 or supplement 2. And as vets, we just watched videos and we had no idea. We didn't even compare one horse across different treatments. We just looked at videos of horse after horse after horse and said how badly they were head shaking. And we didn't know, we didn't compare a horse across different treatments. We just looked at videos and we didn't know what treatment they were on. And we discovered there was a significant placebo effect to the owner of both supplement and placebo. So about 30% of owners said, I think he's better on either supplement 1 or supplement 2. And that was equally spaced out. So it doesn't work. There was no improvement to the vets, and the owners thought it might work. So just be aware of that one. A hormone vaccine. Now this was done again with Kirsty Pickles, who I work with quite a bit. She had a look at a gonadotrophin releasing hormone vaccine. Now what's that about? Well, it's more common in geldings potentially, and therefore treating them with this hormone vaccine might work. Now they did it in 15 horses before they stopped the study because of a significant number of vaccination reactions. But there was no actual improvement. But again, about a third of owners said, I think my horse is better. So be wary of, I think my horse is better. What about very high doses of steroid? No response. And this was done over in the US. And this is now understandable because we've got no inflammation on the nerve. So in that study that I've done, and they've also done from Davis, they've looked at sections of nerve under the microscope, and the nerve is the most normal nerve in the world. And therefore treating it with anti-inflammatories isn't going to help. But that obviously wasn't known when this study was done, and treating with strong anti-inflammatories seems a very logical and sensible thing to do. It didn't work, and now we know why. What about various? So I'll show you all the various in a bit. Now this was an owner survey that John Madigan ran over in the US, and this was an owner reported diagnosis and owner reported outcome, so be wary. However, they looked at 109 horses, and so even if you've got some owner reported misdiagnosis and owner reported over enthusiastic outcome, something would stand out, wouldn't it, if it was working, you know, but it wasn't. And they looked at all sorts of stuff. So antihistamines, antimicrobials, corticosteroids, bute, that kind of drug, melatonin, chiropractors, acupuncture. So nothing is standing out at all, which is pretty miserable, really, isn't it? So that's what doesn't work that's been published. What can work? So I'm sure you'll have tried these. If you're worried about your horse being a head shaker, you'll have tried a nose net. It's the first treatment to try. There's lots of different types. I think you try several, like usually 4 different types. Get them, again, this is where social media is really useful, you know, borrow them, share them amongst yourselves. Rather than spending money, work out if you need a competition legal one or not, and find if one suits your horse. Cheap, non-invasive, risk-free, and you can compete at most levels. What can you expect? Up to 70% relief in 25% of cases. So 75% of trigeminal mediated head shakers are not going to be any better. The ones that are can be 70% better max. Now, if you're a mild head shaker and you're 70% better, that's probably all right. If you're a moderate head shaker, 70% better may not be enough. If you're a mild head shaker and you're a top dressage horse, 70% better is not going to be enough either. So it's a tricky one, but it is worth a try. So how does it work? Gait control theory, what's that? Well, if you bang your elbow, what's the first thing you do is you rub it, and it doesn't actually make the bruise any less, but it stops it hurting so much at the time. And so that's gait control theory. That's where by making some nerve fibers fire, you make other nerve fibers be quiet, because they go through what's called a gate in your spinal cord, and it can't cope with quite so much stimulus, and it doesn't let all the pain stimuli through. And any of you with young children like I have, or who have had young children, will spend a lot of time rubbing things better. And that's exactly what that is. So that's where your nose net is, rubs your nose. It makes sense, doesn't it? The horses are desperately trying to rub their noses. So the nose net is giving the nerve a stimulus all the time. Now, that's not enough for some horses. Some horses find that stimulus very distressing, and you have to take the nose net off. Others find it really, really useful. And a lot of the ones that find it useful will never see a vet. They'll be in that, you know, proportion of horses that didn't have to see a vet in our survey study, because you're sensible and you buy a nose net and your horse is fine and you just crack on. So here is one example. So this little mare she just was using for pony club and riding club, lovely little horse, they'd bred her. She head shakes. It's not horrendous, but no one's having a nice time. She's in pain and a rider can't do what they want to do. You add a nose net, make that one pay. She's a lot better with a nose net. Just a little twitch up this side. But you know, we're all right. I think she's certainly doing what she needs to do for her job, and I doubt very much she's experiencing a type, you know, particular pain. I think she's going really quite nicely. But you can up the ante a bit. So add a face mask. So again, this is where I said I wasn't going to tell you about non-published stuff. This isn't published, sorry. But covering the eyes as well can reduce some stimulation of the ophthalmic branch of this nerve. So if the eye mask alone is effective, you try the contact lenses, but often it's not enough. But doing an eye mask and a face mask can really make and a nose mask together, so a full face mask can make a difference. And that's what we've got here. So we've now got the eyes covered as well. And she's just that bit better again. And this is the Grand Prix horse I showed you earlier. So he is fine just with his eyes covered. He's not all about his nose at all. So what about drugs? Well, what's out there? So cyproheptadine, which is a type of antihistamine, is published. Cyproheptadine works in the brain though. It's a serotonin inhibitor, antagonist. And it probably works on head shakers that way rather than being anti-allergy, because they aren't allergies. So if your horse responds to normal antihistamines, there's probably a degree of allergy in there. But we're not 100% sure for sure In fact, we're not about 5% sure. But cyproheptadine is published. Carbamazepine is a drug that's used, again, for neuropathic pain in people, but is actually an anti-epileptic. So these are both drugs that work on the brain. Gabapentin is a drug that's used very commonly for neuropathic pain in people. It has been published actually by Yvonne, who's a colleague of mine, for neuropathic pain in the horse, but it hasn't been published for head shaking. So even though I said I wouldn't talk to you about things that aren't published, I have a couple there, haven't I? But those are the drugs we know a bit about anyway. Now, in people with neuropathic pain, these drugs have inconsistent results. So any pharmaceutical for neuropathic pain. So some individuals respond well to one drug, not to another. Results can be short-lived, but response to medication can help for diagnosis. So one of the things that carbamazepine is used for is for people with trigeminal neuralgia, is if they are better on carbamazepine, that helps you reach the diagnosis of trigeminal neuralgia, even if they aren't better on it for long enough to be used for treatment, or the side effects are such that they don't want to use them for treatment. What are the side effects? Usually drowsiness, and you feel a bit like a zombie. That can wear off, and it doesn't happen in everybody, but it certainly can be there. Now, in trigeminal mediated head shakers, the carbamazepine and cyproheptadine have been published, but they have very inconsistent results. So sometimes they work, sometimes they don't. Depends, I think, very much on the individual, and nothing's been published for gabapentin. And again, results can be short-term. Now, our outcomes are likely to be worse in horses even than they are in people, because we don't even know how many tablets to give them. We kind of go, oh, well, horses 5 people, maybe 7 people, probably, and then there's a few tablets left in the bottom of the packet, so let's chuck them in as well. We don't know how many tablets to give them. They have a very different digestive system to us, so why would it work the same? So that's the first one. We may or may not get a useful dose into the horses. It can be incredibly expensive to get a useful dose into a horse. Some horses can be sleepy. Does that mean they're safe to ride or handle? Well, be careful. But equally, that drowsiness may wear off, or may wear off on a lower dose. And certainly when I try these drugs, I try high dose. There's no point faffing about on a low dose and saying, oh, I don't know if it didn't work, so I didn't get enough tablets. And give them a load of tablets. If it works, you can always drop back. Some individuals can respond well. So I do 2-week trials in appropriate cases. What's an appropriate case? There certainly can't be a competition horse. You can't compete on these drugs. So I do use it sometimes, but it doesn't. I do tend to do it later on when other things aren't working. It can be very expensive. Even if you find out that the horse does do well on these drugs, it can be very expensive to maintain them on them. What else is out there? So homeopathy, this was a study that looked at 20 horses. It followed up 15, and most of those owners said, I think my horse is a bit better. I am no believer in homeopathy, and it's different to herbal medicine. Don't get the two confused. I don't think it can work, and I think that's another example of placebo. I'd love it if it wasn't, but I think that's there. But there we go. It's in the literature, so we have to report it. What about sodium chromoglycate eye drops? Now, what are sodium chromoglycate eye drops? These are used for allergies. If any of you have hay fever, or in my case, a horse allergy, yeah, don't laugh, and you get itchy, runny eyes, this is great. You put these eye drops in and it stops what's called the mast cells from bursting in your eyes and making you all itchy. And you buy them in the supermarket. Super stuff, and these were done in 3 seasonally affected horses. They put the eye drops in and the horses stopped head shaking. However, we don't know with these horses what signs they presented with particularly, or how they were investigated. So it's what's called just a short communication. It doesn't tell us very much. So I think it's unlikely to help the vast majority of horses, but if you want to try, you buy them for £5 in the supermarket, put them in the eyes for a week or so, 3 times a day, and if it doesn't work, right? What else is out there? This is some of the newer stuff, again from work over in Davis, that found that if you supplemented horses with oral magnesium, it reduced head shaking. The type of magnesium is citrate. That's one of the ones that they find easier to absorb. boron is in there to help them absorb more magnesium. So the boron in itself isn't doing anything. It just means that they can get more magnesium out of what they're eating with their supplement. Feeding concentrate had an effect, although less so. They compared horses just on hay, horses on hay and hard feed, and then hay, hard feed and magnesium. And they all head shook a little bit less the more electrolytes, I expect, effectively that they were getting. So they've made that into a supplement, but which is available in the US, but we can't get it in the UK because we aren't allowed to feed our horses boron or cattle or anything. And that's not because boron's bad, that's just because nobody's done the paperwork to make it licensed. And I've spoken to a few feed companies, and trust me, no one's going to do the paperwork. So we shall have to live without supplementing boron, but we can certainly supplement magnesium. And I think you should. I do think you should put your horses on a magnesium supplement, and I think you should put them on a balancer to try and make sure we give them optimum electrolytes. Now, why might it work? Electrolytes are very much involved in nerve firing. I don't know if what we're doing is treating the problem or treating the underlying cause. I don't know. The suggestion has been that potentially it's the underlying cause. I don't know. It may just be that we're treating the problem and there's another underlying cause. So feeding magnesium and a feed balancer is something that I think you should do, but don't expect too much of it. So all that happened with the horses in this study is they head shook ever so slightly less. It was real. They did head shake a bit less. They were still head shaking. There was no way you could go riding. So don't expect a miracle. What is interesting is it opens paths for research. So I think watch this space here. I think that there may well be a lot of movement, and we may find out more, and this is why we're taking blood and urine and things like that. But do it, but don't expect a miracle yet. But again, it's an interesting area that I think will evolve. Other times people say, well, what about surgery? If there's a problem with the nerve, can't you just cut it? And that was tried. So Tim Mayer, who works at Bell Equine now, he did that when he worked at Bristol, and he was really leading the way because we didn't at that stage recognise this really as being a nerve problem. And he cut the nerve in these horses and 3 of them got better. So hello, everyone, this is a nerve problem. We didn't know that. It still took a long time before it was widely accepted. But why don't you do it? Because cutting nerves is bad, it causes pain, they try and grow back. So I think it was very important research, but it is not something that we go and do. So when I worked at Liverpool with Professor Nottenbelt, and this is very much his ideas, we looked at trying to make that surgery better by trying to induce scar tissue in the nerve. And we actually did okay in some horses. We got these guys back to work, but what we were worried about was that a lot of them had quite bad side effects where they would rub their noses and self-traumatize. And this is a picture of one who really wasn't bad at all. They could be very, very distressed. And that's horrible when you're a vet. You never want to make horses worse. And we did. And a lot of them got better, but 4 of them didn't. And out of 58, which is quite a lot. So we really try to avoid doing this surgery now because we have something better. I think it was an important step to have done, but it is not something I particularly want to go back to. So where are we now with treatment? Neuromodulation is what I've been working on the most recently, and that's together with the Medical Sciences Department at Southmead, who are part of the university. Lots and lots of possible treatments for people with similar neuropathic pain syndromes. There's no one good solution. Probably will not find a one-size-fits-all for head shakers either. But one thing that you can do under NICE guidelines if you have neuropathic pain, just one of many, is percutaneous electrical nerve stimulation, which is a type of neuromodulation. It's minimally invasive, used for management rather than largely cure in people. There are some blinded trials, so it does work in some cases, but there's no basic science, and nobody knows why neuromodulation works or how it works. And that's really frustrating because then how do you make it better? What do? You place an electrically conductive probe over the offending nerve, stimulate it at various frequencies and voltages for a set period of time, and perhaps anecdotally a bit, this sort of says try 3 treatments, and if it doesn't work, walk away. So that's where we are in people. Importantly, people said, you know, once the probe's in place, it's actually quite nice. And there's no reported side effects other than a bruise in people where they put the probe in. So we thought, well, hopefully we will at least do no harm. It probably won't work, but let's give it a go. Now, this is one of my favourite horses ever. Dude having his procedure here. So there's the nerve, the probe is over the nerve and it stimulates it, and on different frequencies you have a twitch, and then on the next frequency you don't twitch, but people experience a nice tingle sensation, so presumably he is as well. So so it is possible to do. So that's what we did to start with. We had 7 horses and we established that it was safe and you could do it understanding sedation. We didn't know if they'd need anaesthesia, which would then make it much less accessible, but you could do it understanding sedation. So we published it at that point that, you know, maybe it's something that's worth looking into, but we had only got short-term data on 7 horses and we got 5 of them back to work, but we don't know how long for. So we then made that much bigger and we published this 2020, 168 horses across the UK and Europe. Everyone used the same technique and equipment, so I trained everybody to do this. Most of them were done by me or close colleagues, but you can't get 168 horses just from one centre, so we did go across Europe for it, but so everyone did as I told them, so we are testing the same thing. 530 procedures off 168 horses. How safe is it? So 8% had complications, which was transient in all but 1 horse, and that one again was a little bit difficult to know if that was a complication or just natural progression. So our complications, we were really tough. I included a hematoma. When that happens, you get a bruise. If you hit the blood vessel, it's right next to the nerve, doesn't matter. It passes in a few days. Dermatitis from scrubbing with spirit to get it nice and clean, so that happens, and again, who cares? A little bit of medical colic that can happen if you have any procedure with sedation and perhaps transport. So none of these were very exciting. The one that we worried about was presumed neuritis, which is where you may head shake a little bit worse for a few days because your nerve has been irritated. So how often does that happen? 3.4% of the time. Suspected neuritis with nerve inflammation. You got worsening of signs that lasted a few days. You could make them better quicker if you gave them steroid. And one thing we did find was that if you had neuritis at one procedure, you were going to get it again. And so what we've been doing is if you have it once, then you get steroid before your next procedure, and that seems to stop it from coming back. But again, we don't see it very often, but it is one to be aware of. But there's certainly no long-lasting problems from it. So what were our results? So you should do 3 procedures. We didn't even know, you know, we did 3 because that's kind of what they do in people. But actually you should do 3. So it is worth doing 3. After 3 procedures, we got just about 50% go into remission. Remission was back to ridden work at their previous level. So half of them this does nothing for. The half that it does help, you're looking at getting them back to ridden work for how long? So 2 days in the shortest. Totally pointless. Not from a research point of view. From a research point of view, it's real, so it's still in there. But from a horse owner point of view, that's more like a kick in the face, isn't it? 2 days. But some of them were going fine by year 5, which was the latest follow-up we did. So on average, how long is your horse going to go into remission? So our average was 9.5 weeks, but that was quite unfair because half of the horses when we did follow-up were still in remission, and so you can't predict how long they're going to go on for. But actually, averages for this type of procedure, it's almost irrelevant. What matters is what it does for your horse, because your horse could be anywhere between 2 days to 5 years plus in remission. And I looked at 70 different things to find a predictor, you know, whether your horse was more likely to go into remission if he was a seasonal head shaker or, you know, nothing. There was nothing that gave me any clue at all. It's a suck it and see, try it and see if it works. So here's the chart that shows what happens. You're looking at the middle line. So about half of them on that middle line go into remission. And then as that line drops, it runs across with time. As that line drops, that's horses starting to head shake again. So if you don't head shake after your treatment for a year, it looks like you're not going to. 5 years ongoing, no head shaking. But that's only 18%. So a lot of horses will respond to treatment, or half of them will respond to treatment. A lot of those will then start to head shake again at some point. So what do you do after that? You do a fourth. Now, normally you go into remission again and for longer, but there is a small drop off, as there is in people, that it doesn't work this time around. And that's the same pattern for number 5 and number 6. And as I said, there were no predictors. So it is a case of try it and see. I think until we know what causes head shaking, we're going to struggle to treat it. We don't know how neuromodulation works. That makes making it better hard. But I think at the moment, it's the safest procedure with the best results available for horses where a nose net doesn't work, but it's still very far from satisfactory. What else is out there? So C's published this, which is using electroacupuncture in a very similar way. And she had it did in 6 horses as an additional treatment. So they still needed face masks and nose nets. And their median remission time was 2.5 weeks. Again, it's just too early. There are some similarities. Her equipment's very similar. Other people's equipment will not be so similar as to what we do with neuromodulation. Whether that's important or not, I don't know. Electroacupuncture is certainly cheaper, but I think you don't quite know what you're getting. There's certainly no comparable study to 168 horses, 530 procedures, and that's what we're missing. So we need someone to go and do that, and again, all using the same technique to see if this is as good, actually, because if it is, that would be exciting because it's cheaper and therefore more accessible. But at the moment, I think we have to say that the evidence is behind using neuromodulation. So just in summary, I think be sure as possible of a diagnosis. Give them concentrate. I know they're mostly on concentrate anyway, but make sure they're on concentrate. Do them a feed balancer. Magnesium, you can't do boron in the UK, so just shove them full of magnesium. Not too crazy, it can be toxic, so do follow what it says on the packet before you get too carried away. Try a nose net, try a face mask, try EpiPens, and if that doesn't work, you start doing trials of pharmaceuticals, but you're starting to get into trouble at that stage, okay? We need to know a lot more about the disease to move forward, so we need people to help us to put up with the fact that when you come for your horse to be examined, we're going to take some blood and we might get something useful out of it and we might not, but we'll keep the results and have a look at them later. So bear with us. Just to finish with a nice one. This is one of the, one of the bad head shakers, isn't he? And then here he is after his neuromodulation. And it's nice to know we do fix some of them. There we are. So I think if I just stop sharing, I'll stick a video on. Hello, I'm still here. So I don't know how you want to run some questions, Colm.
Yeah, we've been gathering questions, so I think Jean's been doing a little bit of sort of work on those. So Jean, I'll hand over to you.
Yeah, I'd just like to say thank you, Veronica. That was absolutely fascinating. It's really, they are awful, these cases, when we see them. Yeah. It's fascinating, it really was. So thank you for that. And I just want to say a quick thanks as well to Colm and Gemma for making this happen, and to all you guys for turning up and listening. So brilliant. And please don't forget to donate to Vets with Horsepower. A lot of the questions that came in were answered during the talk. So things around horses doing it when they're ridden but not on the lunge. So I'll skip through some of those. But we did have a question from Lauren about does it always have to be a vertical shake? I think we've just about answered that, but her horse has episodes of shaking his head horizontally that are very vigorous. It becomes dangerous with the odd vertical head toss when he's exercised.
They are normally vertical. You will get some that sort of it's vertical but a rotate at the top. Real side to side to side to side is usually something else. But but it is one of those that, again, that they're the ones that you just spend longer looking at. Watch videos, watch the horse, and actually potentially one that you would do a nerve block on. You know, the ones that haven't quite read the book and you're not sure. I think that's where a nerve block can be really helpful, and maybe you have to do it more than once, you know, to be sure. But that it is, yeah, they're worth investigating, definitely.
And there were quite a few questions around, for example, from Sana about Hilary Clayton webinar a few days ago, talking about kissing spines, resulting in head shaking, questions around wobbler disease, ECVM, if that can cause head shaking, anything to do with the spine. I think you sort of covered that a little bit, but just to reiterate that it's not those nerves.
Yeah, it's they can still head shake, but they shouldn't be snorty sneezy. So you can head shake because your back is really stiff or painful, or, you know, there's all sorts of reasons, but you shouldn't snort or sneeze. And a bit like the grey horse I showed at the beginning of the event, I mean, looked like a pretty classic head shaker, but she wasn't snorting or sneezing. And as soon as the rider got off, she stopped shaking. And it sometimes you would say maybe that's a poor rider, but she really wasn't. She's a very good rider. So again, you go looking for something else. So, but there's lots of other things that cause head shaking, definitely, but they shouldn't be snorty sneezy or rub their noses or anything like that.
Thank you, that's great. And then Lena has asked, is this linked or is it just bad luck? Her horse is a head shaker and also a shiverer. So.
Oh, no, that's really interesting. No, I haven't come across that even. And actually sort of anecdotally, if I look back at my case population, I think I've probably seen, as you do, one or two shiverers in it, but not more than I'd normally see in the hospital. But it certainly hasn't been looked at specifically. And obviously it is in shiverers, we know quite recently actually some work on it, we know quite a lot more about it, but those nerves aren't, I believe, normal histopathologically. So yeah, open to see if that changes, because there is something, isn't there? But I don't know that they're exactly the same thing.
Thank you. And then another one, can head shaking affect the tongue?
The tongue is mostly sensory innervated through a different branch. So you will get some horses that stick their tongues out quite a lot when they are head shaking, but I don't know whether they're just trying to lick their lips that have gone all pins and needly or not. I haven't seen any of them try any sort of tongue trauma or anything like that. Well, they will with their noses, really, they'll rub their noses raw. But you know, there is a branch of the same nerve, but they don't seem to sort of rub their lower jaws, do they, which would be the same branch. So I haven't really seen that, I don't think.
And then just around the nose nets and masks, there were some things around a product called XLVets, which I think something goes up the nose in combination with nose nets, but also around the liquid titanium masks, which I think are like the calming masks that go over the head but not the nose. Is there any thoughts around those, whether they are
I mean, there's certainly
beneficial?
not there's certainly there's no published evidence for the only published stuff is actually looking at the equilibrium style nose nets, but people do say different nets suit different horses. So then that's where I was saying, do try several, don't try them forever. So that's why I tend to say to people, try about 4 quite different ones. So you might try nose net, you might try one of the titanium jobbies, you might, but again, don't spend the money until you know it works. And that's where swapping between yourselves on social media is really helpful. You know, but rather than spend lots of money and then be stuck with something that you try on your horse for a week and go, oh, that was rubbish. You know, wait and see what, you know, one size won't fit all. So do you try different things?
Thank you. We had I'm not sure who it was from, a question around a horse, somebody with a horse called Rocky, who had a TMJ problem that was treated with steroid, but also head shaking. He's had 2 treatments of pens. At the first at Liverpool, he had to be very heavily sedated, and they said he was the most reactive horse they'd seen. There was a little improvement with tolerance in his second treatment, the question is, have you experienced successful results with horses that have been very sensitive to the lowest dosage of pens?
Oh yeah, definitely. So the machine, the lowest it goes down to is 0.2 volts, and that's because it's made for people. And if you put in 2.2 volts in a person, they barely, I mean, they wouldn't even know you were doing anything. And in a horse, most of them know about 0.2 of a volt. So if the machine went down to 0.1, trust me, I'd use it, just it doesn't. So 0.2 can be very exciting. And you go up 0.1 of a volt in increments, and it can be, you can have a dramatic reaction from doing that, which again, in a person at 0.1 of a volt is a bit, and I guess their nerves are so big and they're 10 times more sensitive, aren't they? So definitely, there's often I'll spend the whole session on the lowest setting, which makes sense because they're 10 times more sensitive. I think what we don't know is what a normal horse tolerates, but of course we'll never find that out because you don't do it to a normal horse. So yes, definitely at the lowest setting. And there are a couple of horses in that study that decided, do you know what, I don't like this and I'm not having it done. It's 2, I think, off the top of my head, that said, I don't like this, I'm not having it. And so they didn't, you know, they had 1 session or half a session or whatever. So that is a known complication.
Oh, thank you. Do you have any specific recommendations for supplements?
I don't, but that's because we don't know enough about it. It's a whole world out there that we need to learn more about. We need to learn more about what's the effect of feeding. So there's lots and lots of work going on, and Davis and some in New Zealand, and looking at acid base and looking at potassium, but we just don't know that much from it yet. So it's hard to gain, you know, it's hard to tell people what to do when you don't really quite know yet. And the work in Davis is very different to New Zealand because the diets are very different. In New Zealand, they're mostly on grass, and in Davis, they're on California, they're on hay. And in the UK, we're a little mix of both. So that's where we're taking blood and urine and wanting to find out, are horses low in magnesium? In the UK, they seem to be low in magnesium in California, but that may just be because that's the way that they're managed. So we need to find out if they're real differences or not. And it's just very, very early. But I think watch this space over the next few years. We should find out more. And the more we know, the more we can then tell people. At the moment, it is very vague. That I just say, the only thing we know is that some magnesium and a feed balance is probably helpful because we can't give you boron in the UK. And potentially changing the diet might help, but we don't quite know how to change it or what to change it from. And that's why I'm taking the urine, because that will tell me the horse's acid base, looking at urine pH. And if that's abnormal, then we can look at changing the diet. But if it's not abnormal, it's hard to know what to change yet, but I do think we'll learn more and actually be able to give people some proper advice. But at the moment, it's very hard to give advice because we don't quite know what to say.
That's really useful. Thank you. Jenny, for instance, was talking about the influence of the horse's forage and diet, and there were some comments about the work in New Zealand.
Yeah,
about potassium and nitrogen levels.
I definitely think watch this space. It's just hard to. It's hard to give advice yet, and it's hard to give advice to a UK population, but hopefully we will get more information as time goes.
Thank you. A comment from Mel, just to mention, please, about donations to the Langford Headshaking Trust as well.
Oh, yes, please. Thanks, Mel.
There you go. Also, a question from Lucy about red light therapy and microcurrent therapy. They've used it on humans. Is that anything you've heard about? And also there was a question about laser versus pens as well.
Yeah, I don't know the answers to that. And it's, you know, it's certainly the useful things that I can go back and talk to my medical colleagues about and say, well, what about this? But it isn't something I've come across, but it's something that I can ask about.
And also a question from Amy about craniosacral work. Is there any, have you got any thoughts on that?
I don't know how it would help for a trigeminal mediated head shaker, other than they probably end up very uncomfortable from all their head shaking. So I guess if your horse does respond to that, then they probably have a different cause for the head shaking, I would think. Again, that there's certainly been no studies on it, which, and I'm not one to say no to stuff hugely, because we don't know enough. You know, for me to be very dogmatic and say, I don't think that works, is wrong when we don't know enough about the condition. But there's no studies on it, and, you know, if it works for your horse, great, but be sure it works. I think just be careful about, you know, placebo and things.
Thank you. That's good. Oh, it's an interesting one from somebody's iPad. There's lots of anecdotal evidence of both leaving or specifically removing whiskers improving head shaking behaviour. Have you seen anything that would suggest this in your experience?
Yeah, it's really interesting. And, you know, someone asked me about that just on Friday, because it's either has become illegal or is about to become illegal in the UK, isn't it? And whether that would matter. And I can see where governing bodies are coming from in wanting to stop you taking off whiskers, because they are important for the horse. And normally people take them off because they look smarter without their whiskers. And that's not a very good reason. Whether, if it did help your horse, you could get some kind of, you know, veterinary exemption letter. I don't know. Some owners find it helpful. Some find that they're a lot worse. And the problem with finding it out is they take an awfully long time to grow back if they're worse. So, but it does seem quite variable. So I guess if we're not allowed to do it, then we just can't do it. But if you know it works for your horse, then there may be a way around. I'm not sure. Great, great.
There's a question from Jan about, can anyone advise where I can get magnesium citrate for horses?
Yeah,
I know
that's a good one, isn't it?
Yeah.
I've tried to get magnesium citrate and boron made specially for me, so that we can get it out, but I haven't managed, because there is too much paperwork. So what I have been doing, all the I'm sure your vet practices will work with Hestavad, won't they, Jane? They've done a good go at a close thing for us. So you can certainly talk to Hestavad, or your practices can talk to Hestavad to get what's probably the next best thing out there. But really the magnesium citrate is just more absorbable, and the boron helps you absorb more magnesium. So, but because there's a risk of toxicity and how much magnesium each horse absorbs is quite individual, it's very difficult to know how much is safe. You know, if you sort of go, well, if one scoop works, then let's give them 2. That might be perfect for your horse, but might make another horse ill. So it's very difficult to actually give proper advice on how much magnesium to give your individual horse. Now, if you do blood and your magnesium is low, then you can supplement magnesium until your magnesium is normal, and you can titrate it that way. If your magnesium is normal on blood, how much extra magnesium do you need to give? I think that's a very, or do you need even to give it, is a very difficult question. But that's why we're taking blood on cases now, which we didn't used to do. You know, this is all new information.
Oh, thank you. Just a question from Sally to ask, could you just repeat the reference about shivering? I missed it.
Oh, as in how many I've seen? I think it is just a couple. I don't think I've seen more than I would in a non-head shaking population.
Thank you.
Did I answer that right?
Somebody's horse, Camille's horse, is snoring. Can it be because of head shaking? He's not shaking with a nose net, but is snoring.
He could have 2 things. That would be more likely.
It's a marker of how fascinating this has been, about how many questions there are here, Veronica.
Well, either that or I haven't explained things very well. You can think either way.
I did have them. There was one that I jotted down, or a couple that maybe veterinary interventions have seem to have triggered it. So, for instance, there was one who, after stomach tubing of the colic, started head shaking. Could that be linked? And then another one after a GA for an unrelated tendon issue, started head shaking. Can things like that be linked?
Yeah, potentially. So if you remember back to the Irish mare Dublin, with that temporal hyoid osteoarthropathy, one of the reasons that you can get the particular form that she has, which is not the same for all of them, but the particular type of arthritis that she had, is if someone's held the tongue while they're tooth rasping, and then the horse has suddenly gone and run backwards, and you've given the tongue a good pull. And potentially this horse had been tooth rasped not by a qualified person, from the sounds of the history. So that potentially, who knows, but that could be what's the underlying damage there, who knows, but it could be. Other things, could they cause head shaking? Yes, but again, I would expect to find, if they are related, I'd expect to find some kind of physical damage. So they wouldn't be causing trigeminal mediated head shaking. They could cause head shaking because of an actual damage to the head or something like that. So I think that's where your CTs and investigating things is useful. Equally, things happen, and one day your horse starts head shaking, they didn't head shake yesterday, and it could be that they had a vaccine the day before. Look at all this stuff with the AstraZeneca vaccine and blood clots. They're actually saying that, you know, yes, you got a blood clot, but you weren't more likely to. One of my friends had seen something, I think, that said, if you go off for your vaccine and you get run over by a bus outside the GP surgery, you weren't only at the GP's because you went for a vaccine, but it wasn't your vaccine that meant you were run over by the bus. So difficult to know, but I would expect if anything like that had caused it, you'd find something when you did a head CT and an endoscopy that you go, oh, look, there's the damage. And actually they would usually do much better.
Thank you. Susan's asked, is there a link between head shaking and eye conditions? And there was another question about a horse who had uveitis, and another one about a horse whose eyes were very watery when they were head shaking.
Yeah, so there are two published things anyway with eyes. So one is the study that I talked to you a little bit about with the allergy eye drops. So I don't try this in a lot of horses, but if they've got very watery eyes, then yes, try it, you know, try the allergy eye drops. The other thing that's published is granular iridica cysts. So that's the black lumpy bits they've got around their pupils. And if they're really big, very rarely can these cause head shaking, but they can do. So if I get one with a granular iridica cyst, we do remove the cyst surgically and see if the head shaking goes away. So, you know, again, you can have two conditions, but I think it is worth exploring ocular abnormalities. I do check the eyes always.
Question from Mel. The blood and urine that you're taking, is it part of a new study? And if so, is that open to old diagnosed head shakers?
Oh, Mel, that's a really good question. It isn't part of a study, as in I can only, so you can take the blood because you want to know the answer and see if your magnesium's low, because if it is, you might want to supplement it and get your vet to send me the results. But what you can't do is take the blood just to give me the results, because that wouldn't be animal welfare ethical. So you have to want to know something from the results yourself. But it's ionized magnesium is the thing to look for in the blood, and urine pH. And then if they're abnormal, you can change the diet.
Great, thank you. I'm just looking through to see what I've missed. Just more about salt therapies as well, but that's the same, isn't it, really?
Yeah, again, electrolytes is definitely watch this space. We just don't know enough to know what to do.
Lots of thank yous coming in.
Oh, that's very kind.
That's really brilliant, thank you. Colm, have I missed any that are...
No, I think you've done a pretty good job there in finding the main themes, Jane, so well done.
Oh, a good one here from Lucy. What would be the best thing to give to help with the pain on the days when my horse is head shaking really badly?
Oh, that's a really hard one. I mean, if we can't sort of find a way of managing them and they're head shaking at rest, I think that's a really difficult one. If they're head shaking at rest lots of days, I think, and we can't find a way of treating them, I think actually euthanasia is one to really, really consider. I know we don't want to do that. You can certainly try ACP, so Sedolin gel, which might make them less anxious about it. But I think it is, you know, we don't have a good fix for these. We really don't. If they don't respond to treatment, we don't have a good fix.
I do remember Professor Nottenbelt telling us all about what a painful condition this is in people, and you know, how it can be a cause of suicide and things like that. And so I suppose we have to remember that they're in a lot of pain, aren't they, these horses?
Yeah, and certainly I think if they are, you know, affected at rest, I mean, every now and again you can have a bad day. I think that's okay. But if you're every day shaking in your field or in your stable, I think your life is miserable if you can't be mended.
Yeah, thank you. I'm just scrolling through lots and lots of thank you. That's,
Well, it's
really,
very kind, and it's lovely to get to sort of do this sort of thing. Although I would really rather that you were all out riding, getting ready for a show.
We would rather
hopefully soon.
We would rather we were sharing your donuts, but there you go.
Yes, I know. I've got a lot to eat tonight.
Yeah. So I'm going to say thank you and good night, everyone. I think I'm just flicking through again. I think we've covered most of them there. So thank you. It's a fascinating subject, isn't it? It really is. Yes, and just Gemma's put the donor box, the link on for the donor box up there for Vets with Horsepower. Yeah, that's in the chat box.
Absolutely, and as we said, there's it has been recorded, so we will share this and all of the other recordings. This is, as we said, this is the 5th one we've done. They're all available, and we will be putting them on our XL Equine website, so you can all watch them again. But we'll share as much of this content with you as you can. It's all freely available.
I love in this subject that, you know, just pushing the boundaries all the time and looking for new things. It's great. Thank you, Veronica, for all you do. Good.
Well, thank you very much for having me.
Okay, well, we'll wrap it up there. Thank you very much, all. Have a good evening. I hope you are in a much better state to, well, we're all in a much better state to get out and enjoy ourselves during the evenings of the spring and summer. So thank you very much. As I said, we run these sessions while the evenings were dark and drawn in. So we're going to have a break now. Let you go off and enjoy yourselves. And we'll probably be back later on in the year and try and do this again because it's been such a success for us as well. So again, thank you, Veronica. Thank you, Jane. Thank you all. And I wish you good night.
Good night. Thank you.